since it's the top of the hour, I'm going to go ahead and get started. I still see some people coming in, but we're going to go over some housekeeping information at the beginning before we start with the presentation. So welcome everyone. Thank you for joining us for the webinar Unveiling the Power of Community Partnerships, Transforming Black Maternal Health Outreach. My name is Veronica Milliner, and I'm an engagement specialist with the NNLM All of Us Program Center. And like I mentioned, I'm just going to go over some housekeeping and some information just a few minutes at the beginning of this presentation, and then I'll turn it over to the presenters. I do have to say I am getting over a little bit of a cold, so you only have to listen to my nasally voice for a little bit, but if you hear a little throat clearing, that's why. And I'm actually going to turn off my camera for this intro. So let's see. Okay, so just some housekeeping information. This webinar is being recorded, and all attendees have been muted upon entry, but we welcome your questions throughout the program. We encourage interaction in the chat, and when you're sending messages in the chat, make sure you have it set to send to everybody, to everyone. And if you have questions specifically for the presenters, we ask that you use the Q&A function located at the bottom of the Zoom window. We're going to do our best to address as many questions as possible during our time together. Let's see, if you require any technical assistance during the webinar, again, please reach out with that Q&A button, and one of the staff will be able to assist you. And again, this webinar is being recorded, and the video will be posted on NNLM's YouTube page in a few weeks. For everyone who is registered for this webinar, you'll receive a follow-up email and a link with the recording when it is ready. And so this webinar is eligible for one Consumer Health Information Specialization credit, or CHIS credit, which is a program provided by the Medical Library Association. At the end of the webinar, a link to an evaluation survey will be shared with participants. After you complete the evaluation, it'll give you instructions on how to claim that CE credit. So we encourage everyone to complete the evaluation form and provide their feedback, even if you don't intend to claim any CE credit. And so this webinar is supported by the NNLM All of Us Program Center. The NNLM All of Us Program Center was created as a result of a partnership between the National Library of Medicine and the National Institutes of Health All of Us Research Program. So I wanted to start out with just a little poll. Let's see. There you go. You should see it now to gain some insight into everyone's previous knowledge about the All of Us Research Program, and also asking for the zip code of where you're joining us from, just to see everyone's the scope of and the reach of this webinar. For privacy, I won't share the results in this webinar publicly, but again, this is just so the NAPC has an idea about your knowledge of the program, and again, where everyone is joining us from. So I'll give everyone a couple seconds, few more seconds to answer that. All right. So just for those of you who might not be familiar with the All of Us Research Program, I wanted to provide just some background information. So the All of Us Research Program is seeking 1 million or more people from across the United States to help speed up medical research. People who join will share information about their health, habits, and what it's like where they live. By looking for patterns, researchers hope to learn more about what affects people's health. So you can learn more about the All of Us Research Program by visiting joinallofus.org/NLM on the screen, and I'll also share it in the chat as well. Again, health research is important because it's how doctors and scientists learn what keeps us healthy and what makes us sick. The All of Us Research Program is one of the largest and most diverse health research programs of its kinds, and they're collecting health data, again, from 1 million or more people in an effort to help researchers learn more about health risk and health disparities that affect our community. And so with that, I'm going to start by introducing our two presenters for today's webinar. So Sarah Montrichard-Ramón Cabrera is a native Floridian who has called Brooklyn, New York, a home for the last decade. She's a proud Trinidadian American who hails from a family of medical professionals that encourage her to pursue a career in public health due to her passion of engaging with communities to promote healthier outcomes. Sarah holds a Bachelor of Arts in International Relations and a Master of Public Health in Health Promotion and Disease Prevention from Florida International University in Miami, Florida. She is also a Master Certified Health Education Specialist through the National Commission for Health Education Credentialing and is also pursuing a doctorate in public health at Capella University. Currently, Sarah serves as the Community Health Coordinator for Brooklyn Public Library in Brooklyn, New York, where she oversees the health outreach and social work teams, which provide health and wellness resources and programs, in addition to social support assistance from Brooklynites. In her downtime, Sarah enjoys spending time with family, cooking, traveling, and dancing to sweet soca music from Trinidad and Tobago. So welcome, Sarah. Thank you. And our second presenter, Nuratu Otulana, is a first-generation daughter of West African parents. Born and raised in Queens, New York, she is a passionate advocate for holistic and whole-body wellness and women's health. Nuratu is a certified birth and postpartum doula, childbirth educator, and has experience supporting lactating women and families. She is also a mother, a daughter, sister, niece, and friend who, through generations of love, wisdom, and support, has made it her life's commitment to participate in and build community. She is an avid reader, cultural art enthusiast, writer, and lover of learning and food. She graduated from Baruch College with a degree in journalism and African American studies. She currently lives and works in Brooklyn and at a community-based nonprofit. So once again, thank you both for being here today, and I will turn it over to you.
Okay, so good afternoon, everyone. And again, I would like to thank Veronica on behalf of Brooklyn Public Library for this opportunity to kick off Black Maternal Health Week. And the hopes that I have for this particular presentation is that you'll walk away with some considerations and some takeaways on forming community partnerships in order to better transform Black maternal health reach or any type of maternal health outreach, whatever that may look like for you at your organization. Next. Okay, so I want to start being mindful that we're all from different parts of the country to give an overview on who Brooklyn Public Library is and give you some insight into where my team actually fits in within the library. So as Veronica stated, I'm the Community Health Coordinator. I am not a librarian by training, but I'm in a library setting. So with that being said, let me tell you a little bit about our library. So Brooklyn Public Library is one of our 3 public library systems that we have here in New York City, with the other 2 being Queens Public Library, which covers Queens, and New York Public Library, which covers the Bronx, Manhattan, and Staten Island. Brooklyn Public Library has 62 branches that are spread out across Brooklyn that serves over 2.5 million residents that call Brooklyn home. We always like to say that there's literally within a mile radius a branch. So everyone in a community has some access to a branch. My particular team, the community health team, is hosted within outreach services. And our outreach services is comprised of 5 various teams. So as stated, my team, which is community health. We have our community outreach team, which works with our vulnerable populations, such as our veterans and shelter populations. We also have our immigrant services department, which provides access to a lot of our cultural programming, as well as our ESOL classes. We also have a justice initiatives team, which works with our prior incarcerated patrons, but also works on other advocacy-related projects. We also have our services for older adults team, which works closely with our patrons that are 50 and older, whether that's creative aging, any type of programs that are targeted to keeping our older adults healthy. So a little bit about my team. So community health is actually staffed by 4 people, not including myself. That is our 2 health outreach associates and 2 of our social workers. And they work to support our Healthy Communities Initiative, which is where the particular maternal health focus falls, in addition to our social work program. So a little bit different in a non-traditional way. 5 of our key areas that we focus on in terms of our health outreach, of course, maternal health being our primary focus. We also provide programming and support for mental health. We also work closely with our services for older adults team in terms of positive aging. We also focus on nutrition and then, of course, health literacy. Next. Okay, and so to give a little bit of background on how we actually kicked off our maternal health initiative. So I have to preface by saying that I actually started my tenure here at Brooklyn Public Library about 4 months before COVID hit. So I know we hate to talk about COVID, but just to kind of put this in context as far as what this timeline looks like, our Healthy Communities 2-day staff conference actually launched this maternal health initiative in the fall of 2019. So our actual conference was in October of 2019. And I started with Brooklyn Public Library November 2019, and then the pandemic hit in March of 2020. Just to kind of put this in context as I kind of give you an overview on where the Maternal Health Initiative started compared to the programming that we're doing now. So out of this 2-day conference, the focus was really to address ways on how we can improve health outcomes for our Brooklynites, also making sure that we leverage the library's resources that already exist, and also increasing health equity. Just because someone has access does not mean that they're necessarily coming into the branches and using those resources that are accessible to them. So that's important to note. So during this 2-day staff conference, what happened? We have 2 of our regional librarians, which I should preface that because our system is so large with 62 branches, we're actually split into 6 regions. And so our central library, which you noted was on the first slide, is actually our headquarters. So out of the 6 regions, we had 2 of our regional librarians that saw a direct need based off of their own personal experiences during their birthing journey, and also just hearing feedback from patrons that were frequenting their branches, that there was a need to really support mothers of color during their pre and postnatal birthing journeys, and to be able to accomplish that by meeting people where they are. If you have family or just anyone, given that the library is an intergenerational space that are already coming through our doors, how can we connect the dots to make sure that they're getting the resources and the programs that they need to maintain a healthy birth journey and supportive from pre all the way to their post journey. And so with that came the idea of what would this particular maternal health initiative look like? So some of the ideas that came up were, what about installing lactation pods in all of our branches? So that was a very ambitious idea. Again, COVID hit and had different plans. So that particular idea was on pause, but then maybe something a little bit more feasible. What about coordinating with community partners to make sure that new moms receive infant CPR training so that, God forbid, something happened, they at least have the skill set to be able to save their life in the event that they have to wait those dreadful minutes for EMS to arrive on site. And so we talked about the pandemic. I think I can speak for everyone when I said that every library system that's done any type of program has learned to adapt, as we did here at Brooklyn Public Library, and we now continue with a hybrid format of programming. We're mindful that especially for new and expectant mothers and mothers who are already postpartum, that it can be incredibly challenging to be able to come to the branch for a program. So therefore, we here at Brooklyn Public Library offer programs that are both virtual and in person. I think I speak for everyone when I say certain external factors, especially being here as an urban library system, factors such as transportation. Can the person get to the branch without incurring delays to arrive on time for the program? Do they have access to technology? If the program is being hosted solely virtually, that can be an issue. Or even more so, family demands. A lot of our patrons don't just have one, child. They have a couple of kids. So what do those demands look like for them to be able to engage and come to the branch for programming? Next. So what does it look like, and what should be considered in planning a maternal health program? So program planning factors that should be taken into consideration, and these are not the only, ones. These are the ones that we here at Brooklyn Public Library truly consider. There, of course, are other factors. I'm just highlighting these. But staff capacity, space, and reach. I think capacity became my absolute favorite word during the pandemic when we all felt kind of stretched. I don't have the capacity to do that, but capacity is very important. Why? Staff capacity is important because it's not only essential to the program coordination and all the logistics that go in to planning and actually seeing a program through, but also the success of the program is based on the capacity. If you're at a branch, how can you promote this program? Do you only have one person that is really, really good with Canva or really, really good with coordinating with your marketing communications team? How are you going to promote this event? Are you going to go door to door, with your local community organizations and promote it? Or are you only going to promote it for programs that already exist? So staff capacity is very important. Space is also important. Not all branches have space to be able to host programs. What your space looks like is going to dictate how many people you're able to accommodate. So it's not realistic if you're trying to plan a program for 50 people and your meeting space can only host 20. And then even though we're not in COVID guidelines, I like to say COVID is still around. A lot of library branches and systems have relaxed their guidelines, but we're still mindful here at Brooklyn Public Library that if the max is 20, we actually go a little bit lower and we may say this program is not going to accommodate more than 10 to 15 people because we want to be mindful that some people are not comfortable being at max capacity still. And besides, if you're doing a program for moms like a chair yoga or chair meditation, you do want to be mindful that you have enough space for them to be able to enjoy the program. Reach is also important. Knowing who this program that's going to be tailored, who is the audience? If you're scheduling a program to take place for new and expectant moms, it may not make sense to do this program in the evening when they may not be coming into the branch. So being able to work with your strategy department and see what the foot traffic looks like for your target audience is another useful tip. And then once you've thought about all the factors as far as starting to develop and plan this program, what do your program options look like? So some program options that we've implemented here based on the scale of staff capacity, space, and reach are webinars, resource fairs, community baby showers, symposium/summits, and program series. And I've kind of rated them from a light lift to like a heavy lift based off of staff capacity, space, and reach. So webinars, they're a great option. If you're short and limited on space and your staff capacity is limited, a webinar is an easier lift because everything for the most part is virtual. A lot of the promotion just needs to probably be done in person at the branch so that patrons are aware. Resource fairs are another way to kind of get your feet wet without having an ongoing commitment with a community partner. So you can start with 2 to 3 community partners, or you can go as high as 15 plus community partners, of course, based on space. I can transparently say that the largest resource fair we've had here at our central branch for Brooklyn Public Library had about 25 community partners. So yeah, the staff capacity was high, the space was readily available, and we had a very large reach, about 150 patrons that attended, just to kind of give you a perspective. Community baby showers are also a great way to kind of do maternal health programming. A lot of new and expectant moms, especially first-time moms, and I'll preface by saying a lot of first-time moms will usually frequent community baby showers. Not to say that second and third and so forth time moms won't come, but essentials like the diapers and baby wipes, which I feel like everything has gone up in cost now since the pandemic, a lot of community partners are willing to donate that in exchange for having visibility and having access to come and participate in a community baby shower. So that's also another great way to kind of do a program. And then finally, capacity again, doing a summit or symposium. If you do a summit or symposium, you can incorporate several options. You could incorporate presentations, right? Instead of doing a webinar virtually, you'll do the presentation in person, or you can do a hybrid event in person versus virtual. You can incorporate a panel discussion. You can have, a clinician. You can have someone from a holistic perspective, like a doula. You can have someone that's in the library. If you have a librarian that's doing maternal health related work or women's health related work, that can come and speak. And then of course the resource fair, where you can have a couple of community partners to come out and provide resources and programs for the information that's being shared. Next. And hopefully you can see it, but this is just a snapshot. These are some of our events, past, current, and future. Almost couldn't remember the word. But the first flyer here is one of our larger lifts. This is our Black Maternal Mental Health Navigating the Fourth Trimester Symposium that's taking place at the end of this month, Friday, April 26th. That particular event is going to entail 7 presentations, resource fair with about 18 community partners, and a panel discussion with 5 holistic perspective. So clinical perspective, doula perspective, advocacy perspective. Yeah, it's quite a lift. We also had a webinar that we did in partnership with one of our community partners, which I'll mention shortly, the current state of maternal child health. As you can see, based off of our foot traffic here, we have found the most success with programming to have an evening webinar. So people are not having to decide between, okay, should I join story time in the morning if your branch does story time in the morning, or having to decide during school pickup, which is usually around like 1 to 3 time frame. At least you get the sweet spot of like 5 to 6 prior to the dinner hour where people are still able to engage in a program. And then speaking about a baby shower, we have an upcoming baby shower at our Macon branch that's happening for new and expectant parents as well. And then during the pandemic, where we heavily had to shift to virtual, we did a maternal health summit, a 4-part series maternal health summit, where each particular date for the summit, I think it was 4 Saturdays in a row, because let's be honest, everybody was at home during the pandemic. So it's not like you were getting away seriously on the weekend, but we planned it for 4 Saturdays, and every single Saturday we had a different topic. So something we call like a program series, but it was a summit. We had experts that were doulas, we had clinicians, we had people for Know Your Rights, even though people weren't going into work, just to know what your rights were as far as being a working mother and going back into work and needing to have a private space to breastfeed or to pump. Next. Is it me or I can't see the bottom of the slide? Okay. For fostering community partnerships, I kind of also want to go over some pointers that I find helpful that our team employs here at Brooklyn Public Library. So we all know that libraries are open to the public. Our space is free, and we're one of the last we're one of the last community connectedness hubs where community partners really want to come in because we come with that trust. We have that visibility. Libraries have the space. And so therefore, we're optimal as far as collaborating for programs. But also with that, we have to be very careful. It's very important to make sure that any community partners that you're considering partnering with, especially with vulnerable populations like new and expectant mothers and postpartum mothers, you want to make sure that you vet the community partner to prevent any type of business and solicitation violations. I know most branches have their own policy around that, but we do here at Brooklyn Public Library have a strict no business and solicitation policy, and we're very serious about that. But most importantly, you want to make sure that when a community partner approaches you, you want to make sure that whatever type of program they're approaching you with, that it aligns with your own goals and your own focus areas so that the partnership doesn't start off one-sided, but it's a mutual partnership. If you're interested in doing maternal mental health, make sure you're partnering with an organization that has that as one of their core areas. So what else should you consider when fostering a new community partnership? What is that organization's reach? Do they actually provide programs and services to your target audience? If you're working with, I'll use an example here, Flatbush. If you're working with the West Indian population, it would make more sense to work with an organization that's possibly based in that neighborhood that may already have what we call entree, or they already are like gatekeepers and they're already well known in the community. There's a level of trust. It's a little bit challenging to try to work with a community partner that may not previously have worked with that particular community. Staff capacity. Does this organization have the capacity to support the planned programs? I can't stress this enough. A relationship with a partner could be broken or it can be sustained, depend on how much their capacity is compared to yours. The capacity ideally should be even so that the community partner is not putting in all the effort and work into planning a program, nor is you as the library, staff doing all of the work. It should be a mutually beneficial relationship. I can't stress that enough. Language capabilities. We're talking about working with underserved populations. Even though we're talking today about Black mothers, we have to be mindful that Black mothers don't only speak English. We have a huge Haitian Creole population here in Brooklyn. Does that particular organization have someone that can speak French as well as Creole? We also have a huge Afro-Latina population here as well, Panamanians, Costa Ricans, Dominicans. Does someone speak Spanish that can translate for those moms? You don't want to make those assumptions. So it's very important to be mindful of that. And then finally, I made it last, and it probably should have been first, expectations. I can't tell you how important and how humbling it is to think what you as the library will have a program plan and end up being, and then maybe the community partner that is at the table with you has a completely different vision. I could tell you from experience, because I believe that sharing is caring, that expectations are so important, and expectations probably should be the first thing that are discussed when you have that introductory meeting to the community partner. What are your expectations? Do you have a set number of mothers that you're expecting to reach at this event? Are there certain deliverables that you have that you want this event to result in? Expectations and knowing them not only for you as the library, but the community partner are so important because it can make or break an event. And I'm telling you that from experience. You can plan and plan till the cows come home. There's always going to be one little logistic that goes left, but knowing what the expectations are can kind of resolve some of that angst and that anxiety. Next. So this is by no means an exhaustive list. This is just to give you an idea and to kind of show you the diversity, which I think is so important, is to have a diverse selection of community partnerships so that you're accurately representing the various perspectives, especially when it comes to something like Black maternal health. So just to kind of give you a couple examples, Caribbean Women's Health Association is one of our community partners. My co-presenter, Diaspora Community Services, is one of our co-partners. Because I referenced we have a huge Haitian population, the Haitian Americans United for Progress is one of our partners. And then some of our clinical partners, we have Downstate Health Sciences University. We also have the New York Presbyterian and Weill Cornell Medicine System. And then, of course, our wonderful host today, the National Library of Medicine and NIH is also one of our partners that funds and makes a lot of our maternal health programs possible. And without them, a lot of the work we do would not be possible. But I just want to stress that it's very important to not only work with some of the smaller CBOs, community-based organizations, but some of your clinical partners, as well as some of the nonprofits, just so that you have a multidisciplinary array of community partners to choose from. Next. Okay, and I just want to end with kind of providing additional information for anyone that may be considering starting to plan Black maternal health or just maternal health programs in general to kind of get an idea of what's done. I believe in working smarter and not harder, just to kind of see what we've done here at Brooklyn Public Library. So off to the right is our brochure that comes in both English and Spanish. And it's the Journey to Parenthood. And this is part of that virtual series that our two regional librarians coordinated in addition to a lot of our other community partners. And it just gives resources. It's not here on this slide, but the other side actually has a book list because we could not be the library without giving book list recommendations for our patrons to have additional resources to follow up with. But for here at Brooklyn Public Library, if you're interested in seeing what kind of maternal health programs and other health-related programs that we have, please feel free to check out additional links. I put the link here for the BPL Healthy Communities series page, as well as our webpage for the BPL Journey to Parenthood, which actually has additional resources outside of what's on the brochure. And then, of course, I'm an open book, so please feel free. My team will tell you I'm available all hours of the night, but I'm really passionate about this work. I think it's important. Education, knowledge is power, being here at the library. Please feel free to reach out. I don't mind doing a Teams. If you happen to be in the New York area, I'd love to meet you in person. But thank you so much for this opportunity. And with that being said, I would like to turn it over to my co-presenter from Diaspora Community Services, Ms. Nuratu Otulana. Thank you.
Hi, everyone. Thank you for your participation. I think that us all being here is a testament to how the Brooklyn Public Library connects us all. And I will be talking to you today from the community partner side. My co-presenter here, Sarah, did an excellent job of detailing how the library shows up, and I will talk to you about how it shows up for us. So full disclosure, this little guy you see here on my first slide, I am a doula, and he is one of my doula babies. He was born in January, and he was my second birth with his mom. So I'm going to talk to you about Black maternal health. Next slide, please. So the libraries are a huge part of community, as Sarah was so kind to detail. You know, they play a role in people's lives across their entire lifespan. As a doula, as a community health worker, we often refer people to resources that are available at the library. I am also the executive assistant to Ms. Karen Jocelyn at Diaspora Community Services, who is herself a Haitian American, and she's been doing enormous work around supporting people of the diaspora, both here and abroad. And if you all are not familiar, there is quite a crisis happening in Haiti that Ms. Jocelyn has been a huge part in supporting the organizations that are women-led in Haiti. And in a lot of ways, those organizations are tied to the work around maternal health. So information that we get here, that we are able to support people there and abroad. We at Diaspora Community Services have relied heavily on the library, both in their ability to service us in terms of space, but also in promoting the programs that we do. Next slide, please. Yes, so one of the things that I am very, very proud to say is that I am an avid reader. I do have all of the New York City Public Library cards. And libraries, of course, provide access to help people improve their quality of life, and their social determinants of health are affected by the information that they're able to get from the library. Again, at Diaspora, we constantly are having information fairs. We do have community baby showers that we have hosted at Brooklyn Library Spaces. We do have research fairs that are also done in tandem with what the library has to offer. We've done webinars with the library. Some of the webinars that Sarah had posted in her slides, I've participated in, and they've been widely informative and very, very helpful in spreading the message about Black maternal health. Next slide, please. So yes, these are just some of the ways that the library shows up as a community space. There was an event that we participated in the fall held at the Brooklyn Public Library that was actually happening when Beyonce's husband had an exhibit there. Beyonce herself also experienced pretty severe maternal health challenges when she was pregnant with her twins, Rumi and Sir. And so when we think about Black maternal health, there's a tendency to think that it is just people who are on the lower end of socioeconomic experiences, but really and truly, it is open to all. If you are a Black woman having a lived experience in a Black body, or you are a Black person, birthing person, having an experience in a Black racialized body, you are susceptible to the challenges that everyone has been talking about and have been present in our lexicon, but many don't know that they are tied to racism. So part of the appeal and appreciation that we have for the library is that it's an open space where information is democratically shared. Resources are shared regardless of your income, regardless of your background and your culture. Next slide, please. And so one of the things that I am very fond of saying, and I do truly believe, is that education about pregnancy should begin before pregnancy, but it does not always. And so again, as a doula, as a child birth educator, and even as a healthcare worker, I am often referring people to resources that are available at the Brooklyn Public Library and libraries across the city of New York. I've lived in other boroughs, or one other borough, and the library is a very rich resource. There are librarians who are accessible and knowledgeable to give information and direction on how best choices and decisions can be made. Next slide, please. So Black maternal health, that's why we're all here, to talk about what is happening and what the current crises are, crises. And in Brooklyn in particular, there was this recent study done, and of course, Black women have ranked the lowest in terms of safe maternal outcomes. And so the Brooklyn Public Library has been integral in helping to promote best practices for people to make best choices and what their resources and their options are. As a doula, my primary role is to educate and support. And so again, that comes from resources that are made available that people can access, whether it's digitally, virtually, in actual hard copies. I am quite fond of books, and I do give them to all my clients. And for those who can't afford to buy books, library cards are always available for you to borrow. Next slide, please. So this is from the recent report done in January 2024 about some of the health statistics of Brooklyn residents and communities of color, primarily communities with Black residents, residents that are from the diaspora, residents that identify as non-Hispanic Black people, have the worst outcomes in terms of their birth experiences. Those health disparities and inequities are highest in the areas that have the fewest resources and services. And so it creates maternal health deserts and pockets where people cannot find resources and the support that they need. Part of the solution for this is a focus area for a greater push to provide services and availability to prenatal and postpartum people across the entire borough, but also in the city. But this particular study was about Brooklyn. And again, the library makes these resources accessible. If you'd like to read the report and you need access to it, you can always go into any library and ask a very knowledgeable librarian on how to direct you. You can print things there, you can save things there, you can share things there. So next slide, please. And so that social determinants of health, right? So at Diaspora Community Services, we've been around for 40 years, and we work with our clients, with community members to address the different factors that create the stressors that create catastrophic experiences in birth, right? And so those are called the social determinants of health. They happen in the body or to the body long before pregnancy happens, and those things affect how pregnancy is experienced and the outcomes of pregnancy. So at Diaspora, we've had job fairs, we've had service referrals, we recently had an event outside with other community partners that linked to services, and we did reference the Brooklyn Public Library, which we have one in walking distance of our actual office, and we're not too far from the main branch on Eastern Parkway. But as part of a community approach, we do rely heavily on our community partners. We cannot do this work alone. I cannot stress that enough. All of you are here today as part of the community who is interested in Black maternal health and wellness. And so that connectivity, that support is necessary in doing this work. Spreading the message is very important. It allows for people to come up with solutions and ideas on the ground level to the people that they are closest to in their communities. Next slide, please. So yes, these are some of the events that the Brooklyn Library hosts around Black maternal health, present and past and future, but not just around Black maternal health, but also around community health and community wellness, which greatly affect maternal health outcomes. And the Brooklyn Public Library has done an excellent job in working with community-based organizations like Diaspora and others, some of which we also partner with, like Caribbean Women's Health Association and Brooklyn Perinatal Network, and our CEO's organization, Haitian Women's Collective, around offering services to people in our community and in our immediate area, but also how those services can be translated to people abroad. Next slide, please. So this is our logo, and our tagline is that we are the communities we serve. And we actually are currently having an event at another community space today. And so I am here representing all of the work that we are doing in-house. But we have a maternal health program. And one of the things that maternal health program works very, very hard to do is to educate and inform community members. But we also have shelters. And we have shelters for young women between the ages of 16 and 21. And those young women are pregnant or mothering. And so we've had events at the Brooklyn Library in support of these young ladies in their parenting journey. We have actually had community baby showers at Brooklyn Public Library spaces where people are welcome to come and to support and to donate and to connect with the people that we are sheltering and housing. Our maternal health program is run by a very competent doula who works very, very hard in bringing services to the people in our shelters, but the people in the community, because we are indeed the communities we serve. Next slide, please. And so this event, It Takes a Village, Diaspora participated in September, and Sarah and team were wonderful in connecting community partners in the room, but also in bringing community members. And so as Sarah was so kind to say, we did have participants who had children. And so our organization, Diaspora, actually had one of our team members who had a separate space available to keep kids occupied while their parents, while their mothers were able to get information, were able to network with other organizations to provide services. We provided food, we provided referrals and resources. So as a physical space, the library does that, but also the staffing, of which Sarah is a part of, also does a lot of work in bringing people together. And right now, Diaspora is having a maternal health expo that includes midwives and pediatricians and nurses from all walks of Brooklyn life. And we will absolutely positively be referencing the Brooklyn Public Library for future events. Next slide, please. And so here are some of the faces of Brooklyn residents. And I thought that it was really important to put this here because as you can see, these three women, all mothers or in various stages of their mothering journey, did have unfortunate experiences during childbirth that led to their untimely passing. But I can assure you that each and every one of these women here have at some point in their lives been to the library. These are our community members. These are what our community members look like. these are the lives of the people that diaspora works to help and support, that I as a doula work to help and support. And so, unfortunately, information does not save people. It makes you aware, but you must do something with it. And so these three young ladies who did unfortunately pass away during their childbirth experiences could not be saved for the reasons at the time that, I mean, we could go into at another time, but they each had experiences that are not uncommon to Brooklyn residents. And so these Brooklyn residents were also library card holders, were also people who came in and took their children to events held at the Brooklyn Public Library. And so it's important when you're thinking about Black maternal health to not other it and think that it doesn't happen to people in your community, because these are the people that you sit across from, that you sit next to, that go to the library also, but they also go to your churches and your supermarkets and your education spaces. And so Black maternal health reaches across all walks of life. Next slide, please. And so these are actually some of the causes when we're thinking about Black maternal health and why women die. And the three young ladies that were on the previous slide had various afflictions that are listed here: hemorrhages, cardiovascular disease that leads to heart failure, preeclampsia, and eclampsia, which preeclampsia is actually what Beyonce had when she was pregnant with her twins. And preeclampsia is high blood pressure. And high blood pressure is not necessarily related to the things that we've been taught that leads to high blood pressure. It isn't directly related to salt all the time. It is not absolutely always a result of poor diet or eating habits. It's related to stress, right? And so in having the Brooklyn Library as a space to educate, resources are made available around health and wellness that encompass all of life and the lifespan. And so in ways to make better life choices or to have awareness of how to do better and what actionable steps to take, we do again rely on the library's participation and support in making this information available, and then also making people aware of how they can make better choices and take next steps and be actionable. Next slide, please. And so these two photos are actually of me as a doula supporting clients. And this particular client was very, very fond of her library space. She studied very, 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 very hard for her particular birth outcome, and she spent quite a bit of time in the library. And I chose her photos here for those reasons. As a doula, we do provide support, and we also provide education. And we partner with libraries in various ways. Libraries are also great support services and reference places for people to have healthcare access and healthcare resource fairs and get connected with services that can provide health insurance and healthcare. Because one of the stressors or one of the contributing factors to the maternal health crisis is continuity of quality care. And not everyone has access to that. But the Brooklyn Public Library has done an excellent job at having resource fairs and health insurance fairs that connect people to health insurance programs and wellness services so that better outcomes can be more of what we're talking about when we talk about Black maternal health. Next slide, please. And so ending it here with books, but books are always available at the Brooklyn Public Library. It is a physical space that houses books and information. And so these 4 books here are recently released and available at the Brooklyn Public Library, which you actually can borrow from if you are a New York City resident virtually. The Brooklyn Public Library has done an excellent job at making digital or virtual book titles available. And these 4 recent books do an excellent job at explaining the specifics of what is contributing to the Black maternal health crisis, particularly as it relates to Black women in stress or Black birthing people in stress, and how advances can be made towards reproductive justice and healthcare. And so it's important to remember that none of this is done in a silo. None of this is done, on your own. It's all done collaboratively. Information is shared collaboratively, and that's how changes are made. Next slide. I think that's the last slide. Yes, thank you. Thank you all.
Yeah, thank you, Sarah and Nuratu, for your presentations. And so right now I'm just going to open it up to questions if anyone has any questions for our presenters. You can feel free to put it in the chat or in the Q&A. Okay, it looks like we have some questions coming in. And so the first one, I'll just read it out. How did you navigate the childcare aspect of hosting programs and resource fairs?
Nuratu, you want me to take it? You kind of
Sure.
spoke to it, but I can kind of elaborate. So
Absolutely.
I think Erica might be asking, and I don't want to speak for Erica, so please feel free to tell me if this is not what you're speaking to. But the co-sponsored event that we did, the It Takes a Village that Brooklyn Public Library did in partnership with Diaspora, as Nuratu said, so we have the actual event on the third floor of our library here. And then on the second floor, we had a separate room that could hold about 25 kids. And it was actually a staff member. This is why I said staff capacity is so important. We here at Brooklyn Public Library, due to liability with dealing with minors, did not feel comfortable having one of our staff be the person to kind of, for lack of better words, man the room. It was a physical male that was there in the room. And basically we talked during our logistical check-ins, which I said managing expectations is important. And this particular staff member from Diaspora obviously was certified to deal with children, which is obviously important. But he had everything laid out as far as I'm going to do activities with the workbook. I have an actual video. I just need you, Brooklyn Public Library, to provide me the space and let me know what the AV setup looks like. And I probably need an HDMI cord. And because we are a trusted institution, we made sure that all of the parents, I think there were maybe about 6 or 7 kids that actually ended up going into that space so that the parents could enjoy the program. It was very important to us as well as Diaspora that the parents saw exactly where their children would be. These children, I should preface and say that they were probably between the ages of maybe 7 and 11, so old enough to be able to speak if something was wrong. But that's how we kind of dealt with it, is we had a separate space that we did and room reservations that was exactly at the same time as the event. And we just did like a little walking tour to show the parents if something should happen, this is where the kids are. So I hope that answers Erica's question.
I'll kind of just jump in right here and say that at Diaspora Community Services, we have various programs. And one of the programs that we have is an art-focused program. And so the participant that Sarah is referencing works with our Artvocacy program, which does a lot of awareness around HIV and AIDS supports, but through an artistic lens. And so he was able to come in with a lot of the work that he does with some of our shelter participants or our shelter residents. And he had arts and crafts and things for the kids to do to keep them occupied. So they didn't feel like they were just out of the way and bored and not doing anything. And the library was great to give us a space for us to do that at that time.
Okay. And so the next question that came in, it is, what kind of work do you do with NGOs that work in maternal health?
Now, I know NGO stands for non-governmental organizations, but Armando, you've got to give me an example because I've been in library world for almost 5 years now. Are you speaking to an organization that is like a nonprofit, or maybe give me a little bit more context? Because to your point, we work with not only clinical partners, so like our NYU, our New York Presbyterian, our SUNY Downstate, but then we also work with nonprofits like Diaspora Community Services, Caribbean Women's Health Association. But then we also have, I didn't mention it, I put their logo up. We have a very close relationship with the New York City Department of Health as well. They have various programs due to funding that has come down from Albany because the Black maternal health crisis is prevalent across the entire United States, but our actual Brooklyn Borough President, Antonio Reynoso, here in Brooklyn, is very passionate about accessing public spaces, so sending his kids to public schools, acknowledging the fact that his wife gave birth in a public hospital, is very much a champion of making sure that our Department of Health has programs where access is available. So there are actually free doula programs for mothers who are lower income, who otherwise may not have access to it. I don't know if that answers his question. I'm checking the chat to see if he put anything else, but I mean, it's like the work with maternal health is so broad. So we work with a lot of organizations where the goals kind of align. So if the NGO is interested in maybe addressing food insecurity, because like I said, we have a social work program. We tie food insecurity in with possibly working with like a WIC, women, infant, and children. What does that particular connection look like to make sure that new and expectant mothers have access not only for themselves, but if they have additional kids? So, I mean, we work with our partners in various ways. I could hear it. He said nonprofit. Yeah. That promote, yeah, maternal health in general. Okay. Yeah.
Okay, I see. It says thanks in the Q&A. So I think that answered. And so the next question that is here, do any of the programs focus on maternal mental health, or will they in the future?
Yes, they do. Kalitra, I don't know. I think it's pronounced Kalitra. Is that a question for both of us? Because I think both of our organizations, I could speak and then let Nuratu speak to what they're doing for maternal mental health, because the postpartum and maternal mental health, especially in Black mothers, is a huge, I hate to say a sore spot, but that's where a lot of programming is. So the symposium that I spoke about that we're actually doing on April 26th is the topic. Black maternal mental health, navigating the fourth trimester, just to kind of give you insight on how much of a focus it is. We have clinicians that are coming in from New York Presbyterian that are going to present on why it's important to navigate, what navigating the fourth trimester looks like. What are some symptoms and signs of the baby blues? Why it's important to go to your postpartum visits. Some moms don't go for postpartum visits. They're more focused on the baby. We have a clinician that's going to give an overview based off of that report that Nuratu referenced in regards to the outcomes for Black mothers. What is the current maternal mental landscape from an OBGYN perspective here in Brooklyn, giving it a clinical perspective. In partnership with the Department of Health with Healthy Start, we also have one of our licensed social workers for that program that's going to give what social support looks like, so that mothers are not, it takes a village is what we say, but that mothers don't have this superwoman complex and are under the impression that you just had a child, now it's your responsibility to take care of the child. Well, who's going to take care of you? And so she's going to emphasize why it's important to make sure that birthing partners, whatever that family dynamic may look like, they're not forgotten. What does support look like, and not being afraid to ask for support, because I think traditionally a lot of Black women have the superwoman complex and they're not likely to ask for help. They don't want to be a burden. And so she's going to speak to why it's important to not think like that. And then we have another clinician that's going to kind of give us our marching orders. What does it look like? What do next steps look like? If this work is important to you, how do you continue to stay involved with Brooklyn Public Library? How do you continue to advocate for diaspora community services and can maybe continue to support mothers? What we find is you have a lot of our grandmothers and our aunties who have already had their kids, and their kids have grown up and have had kids, that are now coming back and giving to the communities for people who may not have those type of supports in their life. So I know it was like a long answer, but I kind of want to speak to how we as Brooklyn Public Library are speaking towards maternal mental health.
Yeah, I mean, I'll just kind of piggyback on that and say that at Diaspora Community Services, as a CBO or a community-based organization, we have a director of social work or social services who is a licensed clinical social worker. And she oversees both our maternal health and our mental health programs. And so there are huge overlaps in services where they will resource each other, both programs. And so services that are provided by one that may have pregnant clients or clients who have maternal health needs or mental health needs, they can work together because both of the program leads report to the same person. And so in making connections and making relationships and referencing other support networks and services. Our CEO, Karen Jocelyn, is excellent at making relationships that help navigate future programmatic work and challenges that we may face. And so bringing those programs together and bringing the work together because they all intersect.
I see two people who have their hand up, and I don't want to have them go by. There's Monique Mason and I think Stephanie Michaels that patiently had their hand up.
Okay.
Oh, somebody just put their hand down. Okay. Stephanie, your hand's up. Did you want to unmute or ask your, oh, Stephanie's off. Okay. Oh,
Okay. May have been I wonder if it was...
Kalitra has her hand up.
Okay.
Oh.
Okay. Can you all hear me?
Yes.
Yes. Hi.
Thank you so much about the responses, both of you all, about the maternal mental health piece. I just wanted to add, because I don't know if it was noticed in the chat, but I was asking if the summit at the end of the month is hybrid or not.
It's not, but I promise you that I'm gunning for the next one to be a hybrid. It's just so many logistics with the number of people involved. I think I said 18 community partners, 7 presentations. It was too heavy of a lift to try to stream it, but that is definitely on my list because I think it should be shared with anyone who's not able to come in person.
Awesome. Thank you so much. Thank you. This is great.
Absolutely.
Okay, and then I see 3 more questions here. So Anna says, how are Black prenatal women being recruited for research? There are so many private clinics and hospitals here in Brooklyn.
Nuratu, did you speak about research? I don't know that you spoke about the report, but I don't
About the report, but I actually can answer this question, or at least partially. So for us at DCS, or Diaspora Community Services, we work directly with clients that we have in our shelters and residences, but also clients who work in or work with other programs. So we have about 13 programs, a mental health program, we have HIV and AIDS awareness programs. We have a Women of Color program. And so people who may be pregnant or thinking of becoming pregnant, we do advertise services there. We do recruit there for informational and research purposes. We have done research studies where participants haven't been invited to attend or participate in the research, but have come from other places or have accessed or have known about us in other spaces. So that's one way that we do it. We also advertise or we make a push to connect to pregnant people or birthing persons in clinics and hospitals and programs offered there, doctors' offices, pediatricians' offices. So wherever pregnant people will be, we can find a way to reach them with the services that we offer.
And another question that I saw come into the chat, Sarah and Nuratu, do either of you feel that there are signs that the situation overall is improving?
It's hard to kind of say that with me being someone transparent of being in public health and what we look at as the gold standard of the statistics. And the report that recently came out from New York State in January doesn't show that the situation is improving. I think looking at it, it has to be relative. I could say that on an individual basis, as far as the programs that Brooklyn Public Library is coordinating with our community partners, I would like to think that the situation is proving from the standpoint that that's one additional mother that is empowered to speak up for herself, or a partner that comes to like a baby shower that's empowered to be able to speak up for their partner if they see that something is wrong. I feel like a lot of these documentaries that have come out, I think everyone on this call is probably familiar with the one that Spike Lee's wife, Tanya Lewis Lee, I think is her name, did, Aftershock, which is available like everywhere. I think that kind of put it on a national scale, that there's a cry that there needs to be a solution. But I think that until we as a community and birthing people and the people that support birthing people ask for better, I don't think that the situation itself is going to improve. I think accountability only goes but so far. I think that it really has to come for the community to kind of demand that accountability. And if you're not happy with the care that you're receiving, to feel empowered enough and educated enough to pick a different option where you're going to be treated and provided with the care for you and your child to have the best outcome.
I will contribute to this with, I guess, the other side of the coin. Are things improving? Unfortunately, I will say not as fast as they should be. The Black maternal health crisis, the maternal health crisis is directly linked to how Black women and women in general are treated. When women, Black women, women in general walk into birthing spaces, how are they received? How are they listened to? How are they supported by care providers? What does the access to care look like, right? Like Sarah and I live in New York, we live in Brooklyn. And so we have services here, right? We're kind of in a bit of a bubble, but there are women across this country who don't have the same access to services and don't have the same availability of services. So in places like Mississippi, if you wanted to juxtapose their maternal health numbers with Brooklyn, they have horrible birth outcomes, but they also have less services available. They have less access to service. In New York City, we're fortunate enough to have mandatory health care for all. Not everyone in this country has that access. When you think about weathering, which is the title of a book that was in my last slide, there's a direct correlation between racism and sexism that contributes to the poor outcomes of women during birth. So if you'd like to gauge the progress that is being made, look at the climate of racism and sexism in this country. And with the repealing of Roe versus Wade recently, that's an indicator that no, we are not moving in the right direction of women's health care and reproductive rights and reproductive justice. Because although New York City is a sanctuary city in a lot of ways, and we don't have a disruption of services, there are people all over the country who cannot say the same. And so when you're thinking about the totality or the enormity or all of the numbers, no, things are not getting better. In a lot of ways, we are going backwards. We are in an election year, and whichever side of the political spectrum you subscribe to, women's rights are under attack. And Black people's lives are under attack. And one of the things that I say to my clients and people in general is that Black women feel about hospitals the way Black men feel about police. So until there is more of a direct addressing of the contributing factors to what makes giving birth in this country so dangerous, i.e. racism and sexism, our numbers aren't going to improve. And conversations like this are crucially important to spread awareness about what is happening and why it's happening. But I don't confidently believe that right now we are moving in the best direction.
Thank you for that. And so the last question that has come in is, I'm not sure if you answered this already. Is the community baby shower open to the public?
Which one? Because I think we both have one coming up, right? Is it the flyer I shared? If it's the one at the Brooklyn Public Library, yes, it's open. The only thing is we ask people to register so we can accommodate the number of new and expectant moms that are coming. But there's no cost. All of our programs here at the library are free. It's open to the public. Yep.
And same for diaspora, whatever programs that we offer, we are the community that we serve. So if you do have a need and you do come to our doors, we will do our best to support you. So all are welcome to our community baby showers and whatever programming we have around maternal health and mental health. You just need to express that you want to participate.
All right. Thank you both for your presentations and sticking around to answer some of these questions. So I'm going to just relaunch a second poll. Again, this webinar was co-sponsored by the All of Us Research Program looking to enroll, advance medical breakthroughs and knowledge by understanding more about all the factors that affect people's health, and realizing that conversations like this are important to advancing those understandings and the research around these health disparities. I'll give that a couple seconds. And as I mentioned at the beginning of this webinar, this is eligible for one consumer health information specialization credit. And so the link is, oh, thank you, April. I saw that you put it in the chat as well. Thank you so much. So if you go to that link and fill out the evaluation form, once you submit it, it'll provide you with instructions on how to claim your continuing education credit. And even if you do not plan to do the continuing education credit, we encourage you to fill out that form to give us some feedback. All right. And so once again, thank you so much, Sarah and Nuratu, for this wonderful presentation. And thank you all for coming today. And I hope you have a good rest of your day. Thank you.
Thank you. Have a good weekend, everyone.
Thanks.
Bye.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.